In addition to the critical criteria identified for each skill, the following will be used in the evaluation of the student's performance. With all comps, you must perform the 12 safety practices. Number 1, you must verify the care or order for the client. 2, perform hand hygiene before and after performing any client care or handling supplies. 3, verifies facility policy and procedures and assembles appropriate equipment and or supplies. 4, consults manufacturer's recommendation when equipment is involved. 5, knock on the client's door. 6, identifies client using 2 identifiers. 7, notes overall condition of the client. 8, explains the procedure to the client and provides for privacy. 9, elevates bed to promote good body mechanics. 10, dons PPE if indicated. 11, upon completion, lowers the bed, applies side rails according to the client's care plan, places call system within reach. And 12, if any abnormal findings are present, report findings to charge nurse immediately. The student is expected to utilize safety practices and provision for privacy when performing all essential skills. Documentation for all skills must include date, time, signature, and other appropriate data. Any action or inaction on the part of the student which jeopardizes the emotional or physical well-being of the client will result in an unsatisfactory grade for the skill. There are 6 medication rights. 1, the right drug. 2, the right dose. 3, the right time. 4, right route. 5, right patient. And 6, right documentation. We will start with the intramuscular injection. This must be performed at a 90-degree angle. You will choose a 20 to 25 gauge that is 1 inch to 1.5 inches long. You will draw up the medication. At this time, I want you to draw up Toradol 1 milliliter. You will pull back 1 milliliter of air. You will insert it into your bottle and inject the air into your bottle. You will hold it up at a 90-degree angle and you will remove the 1 milliliter of medication, ensuring that there is no bubbles or air within the medication that is in the syringe. You will recap the needle with a scoop method. If you draw up this medicine other than the patient's room, you must label it. You will be locating the 3 IM injection sites. The first one will be the ventrogluteal. The ventrogluteal is recommended with medications that's greater than 2 milliliters. You will locate the ventrogluteal muscle by positioning the patient in a supine or lateral position. Flexing the knee and hip helps to relax the muscle. Place the palm of your hand over the greater trochanter of the patient's hip with the wrist perpendicular to the femur. Use the right hand for the left hip and the left hand for the right hip. Point the thumb toward the patient's groin and the index finger toward the anterior superior iliac spine. Extend the middle finger back along the iliac crest toward the buttocks. The index finger, the middle finger, and the iliac crest form a V-shaped triangle. The injection site is in the center of this triangle. The next site is the vastus lateralis. You will use the middle third of the muscle for injection. The width of the muscle usually extends from the midline of the thigh to the middle outer side of the thigh. You will use your hand and you will place one hand at the greater trochanter and one hand above the knee, and it will be in the outer third of that muscle. The next one will be the deltoid. The deltoid, you will use this site for medication volumes that are 2 milliliters or less, or for most vaccine sites. You're going to have the patient relax their arm at the side and flex the elbow. The patient may sit, stand, or lie down. Palpate the lower edge of the acromion process, which forms the base of the triangle in line with the midpoint of the lateral aspect of the upper arm. The injection site is in the center of the triangle, about 1 to 2 inches below the acromion process. You can also locate the site by placing 4 fingers across the deltoid muscle with the top finger along the acromion process. The injection site then is 3 fingers breadth below the acromion process. Now you will be injecting the Toradol into the deltoid of the patient. So you're going to have the patient in the correct position. You're going to wash your hands and apply gloves. You're going to cleanse the site with a circular motion working outward. You're going to let that dry naturally. You're not allowed to blow or fan the site. Once it is dry, you're going to isolate the muscle, remove the cap. At a 90-degree angle, you're going to inject the medication. You're going to pull back on the plunger to ensure that you have no blood. Then you're going to inject the medication for the amount of time that is recommended by the manufacturer. After you have injected the medication, you're going to remove the needle. You're going to cap it for safety, and you're going to dispose of it properly. You're going to ensure that that patient is not bleeding, or a Band-Aid is applied if necessary.